comenzamos esta linda mañana con un tema relevante en la vida de todos, la salud cardiovascular, la actividad física y el deporte. Queremos conocer un poco sobre estos avances y lo que nos plantea la medicina moderna en estas áreas. Gracias al Houston Methodist por esta oportunidad. Quiero invitar en esta oportunidad a su presidenta, la señora Katia Easter, quien se va a dirigir a los presentes.
Good morning. And on behalf of Houston Methodist, I would like to thank all of you for allowing to thank CEAL for your kind invitation, as well as thanking the organizing committee. Special thanks absolutely go to Mr. Camilo Atala and Mr. Emmanuel Sedner for this kind introduction to CEAL. I would also like to thank my team from Houston Methodist, Mr. Jose Nunez, who I believe many of you have met, Ms. Melissa Pena, and Eve Juan, who is somewhere about. I believe as busy executives, all of you know the value of not only your time, but of your health. Your health is incredibly important, not only to you, but your family, and health is good for business. And so we are honored today to have two great ambassadors from Houston Methodist to talk to you about health. Dr. Vijay Jatwani from our sports medicine division, who will talk about prevention of sports injuries, as well as providing you on insight with what to do before you begin training. And Dr. Christina Bocernia, who's the medical director of our wellness department. She's also going to provide us with good advice about living healthy and staying healthy. If you have any questions at all about Houston Methodist, our global team is certainly here to help. But lastly, as I introduce Dr. Bocernia, I would again just like to say it is such an honor and a pleasure, and we look forward to this partnership with CEAL as the years go by. Thank you again for having us.
Muchas gracias, Katy. Queremos invitar a la doctora Cristina Bocernia al escenario. Es doctora médica del Departamento de Medicina Preventiva y Bienestar del Houston Methodist.
Good morning. Buenos dias. Everybody went for a run this morning, right? So my part of the talk is going to be about wellness and prevention and how to stay healthy and how to prevent illness if possible. So the objectives for my talk would be to help you understand how important it is, the personal choices that we make, how wellness and prevention are going to help in our personal and professional lives, describe the food and nutrition roles in staying healthy, and also physical activity. And lastly, I'm going to talk about what's next in wellness and prevention, and I'm going to talk to you about a couple of very exciting programs that we're developing at Houston Methodist. I'm going to have some medical background, so hopefully you're going to find that helpful. For the United States, the life expectancy at birth is almost 80 years, so we have hopefully long lives ahead of us. So we do want to stay healthy and enjoy the life at its fullest. Heart disease and cancers remain the main causes of death, and among others are stroke and diabetes. Unfortunately for the United States Hispanic population, cancer is starting to surpass the heart disease in terms of mortality. So hopefully knowing the racial disparities, we can do something about it, detecting cancer early and helping people achieve the appropriate treatment if they do develop cancer. So that slide reflects that trend over time in terms of cancer mortality. So there are a lot of things that we know are not healthy for us. Smoking, for example, it still remains fairly prevalent among populations around the globe. It's more common in men than women, So hopefully we can help. We as medical professionals, there are a lot of community support groups to help people quit smoking if they do. Alcohol, of course, a little bit is okay. Too much, it's not good. And there are recommendations in terms of what's the optimal amount. I never encourage people to start drinking for their health if they don't, but if they do in moderation, there's no clinical data showing that moderate alcohol use is detrimental for health. I don't need to talk about drug use, that's bad, don't do it. So there are multiple chronic illnesses that are linked to the choices that we make in life and how we eat, how we take care of our bodies, and I've listed some of them. So I'm going to talk about a few of them. Heart vascular disease, cholesterol, stroke, and even some cancers. There is emerging data showing that several types of cancers are linked to lifestyle choices that we make. This is pretty intuitive. Obesity, it's still fairly prevalent. In the United States, there are some states that have a much higher prevalence than others. And it is also common in the Hispanic population as well. Lifestyle choices are important in preventing obesity, or if somebody struggles with weight, they're great choices that we can help as medical professionals, also community support as well. So I listed here the classifications based on body mass index for the different categories of weight. And weight is more than just a number. We don't really care about the number as much. We also do body composition when we evaluate patients to ensure that somebody who is actually very fit, pretty muscular, and has a higher weight is not classified into the overweight and obese when they're actually very fit and healthy. High lipid levels, again, not surprising, linked to diet, to exercise, and there's a lot of clinical data that shows that diet and lifestyle should be an integral part of the recommendations for treatment for this condition. Heart disease. There is so much data nowadays in terms of clinical trials that show that besides medication, intervention, state-of-the-art, everything that is being done, at Houston Methodist, along with other places in the world, very important to encourage people to adhere to a good lifestyle, diet, exercise, and for primary prevention, which means preventing heart disease to begin with, as well as secondary prevention for people who have had problems and are struggling to manage their chronic condition. Cancer, this may be surprising to some of you, but data from World Health Organization and multiple clinical trials in the United States and Europe have shown that certain cancers can be linked to lifestyle choices. Breast cancer, prostate cancer, certain types of colorectal cancers, some of them can be preventable through healthy lifestyle choices. Diabetes, this is probably one of the most commonly used example in terms of chronic illness, where improvement in blood glucose level and long-term control are going to be affected significantly by how we eat and the amount of physical activity that we get. In hypertension, the same idea. It's one of those chronic conditions that we can manage in addition to medications to certain lifestyle choices. And I'm not going to spend much time with stroke. It's the same idea. It's linked to high blood pressure, to diabetes, to cardiovascular disease. So how do we improve our health? For those of us who are lucky to be healthy, how do we stay healthy? For those of us who might have a disease, we hope to catch it early before it turns into a significant problem. And for those of us who already have diseases, there are ways that we can help manage those conditions and hopefully prevent complications. Very important nutrition. We always talk to patients. It's part of our wellness program. We don't focus necessarily on, fat is bad or certain foods are bad. We look at macronutrients, micronutrients, and we want to make sure that people get a healthy diet overall. There are a lot of studies out there. There's a lot of data, some of them empirical, some of them are based on, celebrities endorsing products and providing information that may not be quite scientific. So how do we filter through all this data and make the right choices? We are big proponents of natural food. Whatever works for a particular person may not be generally effective for everybody. Portion control, very important. It doesn't mean that every so often we can't have, whatever we want in, larger quantities. For most of the time, being careful of how we choose foods and how much we eat is going to be extremely important. I do, most of the time, advise to avoid processed foods, avoid excessive large amounts of, for example, red meat on a general basis. And artificial sweeteners sometimes are not that good for you. And high-calorie foods, sometimes it causes an insulin spike, and patients are going to feel very hungry very shortly after if we eat foods that don't have a lot of nutritional value, just high calorie. Physical activity, again, something that is essential to our well-being and something that I'm a big advocate of. Cardio is very important along with strength training, and both of those are going to help maintaining a normal weight, maintaining a healthy lifestyle. As we get older, it's going to help prevent falls and help with our balance, and also extremely good for bones to prevent fractures, especially hip and spine fractures later in life. It is recommended from different professional societies to get at least 150 minutes of physical activity that is moderate to intense a week. For people who want to achieve, and Dr. Jadwani is going to talk to you more about physical activity and fitness, 300 minutes a week would be advisable if people want to be more physically active. Beyond 300 minutes a week, there's no clinical study that shows that it's going to improve cardiovascular risk and benefit to your health. It doesn't mean that it's not beneficial. Those of you who are, professional or, just amateur athletes, it's a great idea. And strength training. I'm a big proponent of weight training for both women and men. And women always feel that they're going to bulk up. You're not. You just are going to feel healthy, and it's really important to add a couple of strength training exercises a week. Sometimes yoga may also help. There are different kinds of yoga. It's very popular everywhere. It also helps with stretching. So how do we start? For those of us who don't do exercise on a regular basis, start slowly, do something you enjoy, find a partner, someone in your family, friends that you can do anything active with, and then increase slowly to avoid injury and to make sure that you keep enjoying what you're doing. So how are men and women different? Of course, we have different metabolism, different muscle strength, different kinds of interests, different bodies, but the principles are pretty similar. The screening may differ as well, but exercise and food and what we choose in terms of our health are fairly similar between genders. And different societies vary in terms of how open they are to women exercising and doing strength training. So hopefully that's going to change as we learn that it's so important for both genders. Screening's very important. Even if people feel well and don't have any symptoms, any problems, very important to see your doctor regularly. We can do different screenings based on age, gender, family history, and develop individualized programs for patients to make sure that if they have any risk and if they have any disease, that we detect it early to prevent it from being discovered at a late stage. And we have individual recommendations based on our physical assessment, the exercises, all the different tests that we do, the coaching, and we tailor individualized screening programs for our patients. So our services, that's pretty much what we focus on in the wellness division: screening, prevention. We have 2 different executive health programs. We do have a healthy lifestyle program typically for people who live in the area and can come and see us regularly. And we also offer travel services. So what's next? You know, right now we know what the clinical trials show, and what's next. We're very excited about the idea of individualized medicine. That's what we do right now anyway, based on the current available tests. But we do believe, and I believe, that individualized medicine is going to be the future. And that's probably going to be based on genetic screening. It's going to be based on how we as individuals differ in terms of our genetic predisposition to illness, our genetic information that is going to become available to health providers to help tailor programs for patients. So we are working on making available 2 different types of genetic screenings for individualized based on risk and on family history and on the assessments that we do. One is going to be cardiovascular genetic screening, and the other one is going to be cancer screening, and it's based on current available data. We selected multiple genes based on our partnership with our pathology department, so we're going to have that available hopefully in the next few months. And that's it. Thank you. I think we're going to leave the questions for the end of the talk, and Dr. Jotwani is next.
Muchas gracias, doctora Bosirnia. Ahora queremos introducir al doctor Vijay Jotwani, profesor de Medicina Familiar, doctor de Medicina Deportiva y asesor de diferentes equipos deportivos en Houston. Bienvenido.
Perfecto. Okay. Buenos dias. I'm going to speak a little bit, focusing the discussion on exercise, the benefits of exercise, and what we're going to do for injury prevention if you were to have an issue come up. Let me take a step back here just a moment so I can get my slides working here. Okay, I think that's the best we'll do. Sorry about that. So I'm going to speak about injury prevention, exercise, and the benefits that you're going to see from that. We'll talk a little bit about beginning an exercise program, and then I'll give you 10 ideas of how to prevent injuries if those were to occur. We're going to talk about a couple of case studies of some examples of how we might take care of injuries at Houston Methodist as well. So I think we know with exercise there are significant heart benefits with exercise. So exercise can decrease blood pressure, It's one of the only ways to improve good cholesterol. It improves blood sugars as well and reduces the chances of coronary disease. Now, the benefits of exercise go beyond heart health. There's benefits for the brain, improved memory. It also can treat cognitive issues as well. In fact, this photo here, and I'm sorry the slides are projecting a little bit off, but you can see from the photo right here that when we looked at students who were sitting down taking an exam, they had a certain amount of brain activation. Just after 20 minutes of walking, those students had significantly improved brain activation, and that shows that benefit of exercise for cognition that can happen with just some very light activity. Now, there's other benefits of exercise as well. There's improved energy. There's prevention of bone loss called osteoporosis. It improves arthritis pain. It also reduces the risk of breast and colon cancer. There's better sleep when you're exercising, and there's also those social benefits of participating in team sports. Now, if there's one thing that we can point to very specifically, it's that exercise can also make you live longer. So we see here in this graph that was published in the Journal of the American Medical Association in 2015, that when you start to add activity, you decrease your chance of mortality. And you can get up near 40% decreased chance of mortality by running for 20 minutes each day, or walking for an hour each day. So those benefits are very much obtainable for all of us. Now, before you start exercising, you may want to consider seeing your doctor, especially if you're having issues like chest pain, difficulty breathing, any feeling like you may pass out, if you have dizziness, if you have some blood pressure issues, and maybe even if you're just above 45 as a male or 55 if you're a female. And your doctor may consider testing your heart in preparation for your exercise program. If there's some breathing issues, perhaps giving you medicine to treat some exercise-related asthma will be helpful. And maybe we need to adjust your medications if you are diabetic when you're exercising. Now, to have an exercise routine that works for you, it needs to be part of your day-to-day activity. There needs to be a chance for that to happen for you. And then you need to start low and go slow in how you increase your activity. And it can start with just 20 minutes of walking. If you have symptoms while you're active, while you're exercising, you may consider stopping. And if you become quite sore in your muscles, you may take a day of rest. That would be okay. One way to track your exercise intensity is to check your pulse, to check your heart rate. And so your maximum heart rate is a very simple calculation. It's 220 minus your age. And then we want to aim for a heart rate around 60 to 85% of that maximum. So for the average 50-year-old male, maybe you're looking at a heart rate of around 150 when you're exercising. Now, to keep that exercise program going, you need to make it enjoyable. Different activities that are fun for you. Sometimes if there's a television show you like, have that on in front of you while you're exercising. Sometimes attending some classes gives you that group motivation that can be helpful as well. And especially in this room, we're dealing with people who are very busy. So you have to make this practical for you. And you can use even little time breaks over the course of the day to total up to that exercise that you'd like to get to have the health benefits. So even just 10 minutes at a time, multiple times a day, can accumulate over the course of the week. Now, if you can carve out that daily activity, your metabolism will stay up. But as soon as you've taken a 3-day break, we see that metabolism starts to come down. So we're going to talk about injury prevention. Not everyone can have injuries prevented, right? So in Houston, we have a big event in town, the biggest in the United States for the Houston Rodeo. We can't stop those cowboys from getting hurt, but there's a lot of things that we can do in general to prevent injuries. And so I'll mention 10 specific things to think about, the first of which is cross-training. So the idea of cross-training is to do multiple types of activities. So by doing different activity, you decrease those muscle imbalances that can occur if you're doing the same thing over and over. It also reduces the chance of injuries like stress fracture. So this is actually my daughter who was participating in a triathlon, and already when you're doing a triathlon, you're getting swimming, running, cycling, all as part of that, which is a great way to cross-train. Another tip to prevent injury is to focus on strength training, okay? Gluteus muscle strength is a common deficiency I see in the clinic. A lot of the lower leg injuries that I see are due to lack of strength training for the gluteus muscles. So if you can make that part of your routine, you can prevent the chances of patellofemoral syndrome, of iliotibial band syndrome, and also work on your hamstring muscles. Hamstring muscle injuries, these big muscles behind your thigh, are very frustrating when they occur and can slow down your exercise routine. So stretching and strengthening for those muscles is helpful. Start slow with your activity. Gradually increase the intensity over time, and that's a way to have a successful program that keeps going. Nutrition's very important. For females, making sure that you have enough iron intake, that's important. For all of us, having good bone health will come from good calcium and vitamin D intake as well. Hydrating, especially in these hot environments, is also very important. 3 to 4 liters water per day minimum is important, and I tell my patients the only way that they'll be able to get that is by getting one of these large 1-liter water bottles and knowing that they're going to fill that up 3 to 4 times per day. You also want to wear the right gear when you're active, and so that will include a helmet for cycling, getting the right grip size for your golf clubs, for your racket, and so making sure that you have the right gear is another way to prevent injury. A lot of you may be runners or enjoy running as part of your activity, and shoe wear is particularly important there. So you want a shoe that's comfortable and supportive. That's the number one rule. And there's different styles of running shoes. So there are neutral shoes, just cushioned running shoes, which is a kind of typical shoe you might see. And then there are motion control shoes, large, little bit heavier shoe that's good for people who might have significant ankle problems or deficiencies of tendon control, things like that. But for the majority of my patients, I generally recommend stability type shoes, shoes that have some support through this arch of the foot. Maybe there is a different color to the foam, signifying a firmer foam in that part of the shoe. Maybe there's some plastic here, and so a stability type shoe generally, I think, works well for most patients. Now, if you can have a sports medicine physio or a sports medicine trained physician at your disposal, that makes a big difference. You don't want to be told by someone just to stop exercising. So if you have someone on your team that's going to promote that exercise and help you stay active, someone like a good physio can be invaluable. Now, another tip to prevent injury is to follow a functional progression if you have been injured. So what that means is if you're coming back from an injury, an elbow injury, for example, you're going to want to gradually increase your activity as you come back to sports to avoid other injuries, such as a hamstring injury as you're coming back from an elbow problem when you go to play tennis. So you want to follow that functional progression to get back to sports. And number one, I would say, in terms of tips to prevent injury is to listen to your body, okay? Let us know as sports medicine doctors, as part of your team, how we can help you if something comes up. Now, what happens if you do have an injury? So this was the Copa America tournament last year that took place in Houston. We had some amazing matches. Unfortunately here, when the Argentinian team was playing the United States team, one of the Argentinian players fell over the advertising, and unfortunately his elbow is not where it should be right there. We had a big team of sports medicine providers available for that event, and that included surgical and non-surgical sports medicine doctors like myself, athletic trainers, physical therapists. As part of your sports medicine team, it might include strength coaches, psychologists, nutritionists that can help you when there is an injury. And there was a lot of preparation that went forward for that event there, and we were able to quickly deal with that injury. And so when an injury comes up, we're going to try to get the diagnosis in a very quick manner. And then we're going to offer the athlete, our patients, all of the treatments that are available to them to get them back to playing safely. When needed, we'll use cutting-edge treatments, newer techniques that we can optimize an athlete's care. And then we want to make the correct decision on when to return an athlete or patient back to the sport of their choice. So here's another example. This is a 20-year-old collegiate soccer player that I was taking care of, and she was hit in the shin by an opponent. You can make out a little bit of swelling here. It's a lot more obvious when she stood up, right here in her leg. She kept playing in the match that she was in, but afterwards had this significant swelling, and she couldn't bend her knee due to that swelling, was having a lot of discomfort. So what we were able to do is pull out a portable ultrasound unit in the training room, and we started to scan her area of swelling, and you can see this large black area is fluid accumulation. We can see that that's still very much liquid by pushing down on that fluid, and using that ultrasound machine and some of our techniques, we're able to insert right there a needle into that area and go ahead and drain all of this fluid that was within her leg. And you can see we're able to get just about all of it out in a very focused, specific way using that technique. Now, after we're able to drain all of this, the patient felt much better. The athlete was able to get back onto the soccer field, was able to participate in the game the next week, and although there was a little bit of recurrence of swelling, the sports medicine team was able to keep that under control. Another example of a patient we might see in our clinic is one of my tennis players who's 48 and had a very important tennis tournament coming up for him. He was having some knee discomfort and had some swelling that was going along with that. His knee wasn't getting stuck in place, but the pain and the swelling was limiting him from playing. He had tried some very commonly available medicines in the States, acetaminophen and ibuprofen, which weren't helping him. He was otherwise healthy. He had some pre-diabetes, and playing tennis was helping keep that under control. And he had a normal knee examination when we saw him, except for some mild crepitation. We did some x-rays in the clinic, and we could see that there was some bone spurs starting to form in the knee. And you can see some of this behind his kneecap in addition to that space between the bones there. Now, he had tried some corticosteroid injections before, some physical therapy previously. He even had lubricant-type injections to his knee, all of which were only temporary in their benefit. So given that we tried those other treatments, we tried something new for him. We went ahead and did a PRP injection where we drew his blood. We put that blood in a centrifuge machine in the clinic while he was next to us. We were able to spin that blood down, concentrate the plasma and some of the growth chemicals that are commonly there, and then as that centrifugation completes, the splitting of the blood and the plasma ends up being very easy to do. And within 10 minutes, we're able to use this combination of healing growth factors, inject it into his knee, and a week later he was able to play in his tournament. We're still going to need to continue to manage his arthritis, but he was able to get to that event that that was very important to him. So to summarize, there's multiple benefits for exercise, including living healthier, living longer. To prevent injury, cross-training is important. Strength training, including of certain muscle groups like the gluteus muscles. And gradually increasing your activity will keep you playing and keep you healthy. It's important to be thoughtful about nutrition, about hydration, and making sure you're using the right equipment for your exercise as well. And when you have an injury, having a team approach to sports medicine, to your injury care, will get you back playing safely. Thank you very much.